There is a mineral in your body right now that is involved in over 300 individual enzymatic reactions. It is required for testosterone synthesis, for nitric oxide production, for insulin sensitivity, for deep sleep, for muscle protein synthesis, and for the regulation of cortisol. Without adequate levels of this mineral, your body cannot produce testosterone normally, regardless of what else you do. You can eat perfectly, you can exercise religiously, you can take every supplement on the market, and if you are deficient in this one mineral, your testosterone production will remain suppressed. Here is the most critical part. A National Health and Nutrition Examination Survey, the largest nutritional study ever conducted in the United States, found that 68% of American adults are consuming less than the recommended daily amount of this mineral. And in men over 60, deficiency rates are even higher because absorption from food declines significantly with age, and common medications prescribed to men over 60, including proton pump inhibitors for acid reflux and diuretics for blood pressure, actively deplete it from your body. The mineral is magnesium, and what I am about to tell you about magnesium and testosterone in men over 60 is something most primary care physicians have simply never taken the time to learn, and the consequences of that knowledge gap are playing out in the daily health of millions of American men. Here is the direct mechanism. Testosterone in your bloodstream exists in three forms: tightly bound to SHBG, sex hormone-binding globulin, and completely inactive; loosely bound to albumin, bioavailable but not highly active; and free testosterone, the only form that actually enters your cells, binds to testosterone receptors, and produces all the effects of testosterone: muscle maintenance, energy, mood, cognitive sharpness, libido. Free testosterone is what matters, and magnesium has a direct, documented biochemical relationship with both SHBG and free testosterone. A study published in the journal Biological Trace Element Research, which followed 499 men between the ages of 65 and 87 over 4 years, found that magnesium levels were the single strongest predictor of free testosterone levels across the entire cohort. Stronger than age, stronger than body weight, stronger than physical activity level. Men with the highest magnesium levels had free testosterone concentrations that were consistently 30 to 40% higher than men with the lowest magnesium levels, independent of all other variables. 30 to 40% from one mineral. The mechanism is twofold. First, magnesium inhibits the binding of testosterone to SHBG. It does this by competing for binding sites on the SHBG protein. When magnesium is present in adequate concentrations, less testosterone binds to SHBG and more circulates as free, active testosterone. Second, magnesium is directly required as a cofactor in the enzymatic reaction that converts LH, luteinizing hormone from your brain, into testosterone in the Leydig cells of the testes. Without adequate magnesium, this conversion step is inefficient. You can have perfect LH levels and still produce inadequate testosterone simply because the enzymatic machinery lacks the mineral it needs to run. Let me tell you about a man named George, 69 years old from Dallas, Texas, retired surgeon, again a medical professional, who came to me because his total testosterone was 610 nanograms per deciliter, which is technically within normal range, but his free testosterone was 6.8 picograms per milliliter, which is low. His SHBG was elevated at 67 nanomoles per liter. He had all the symptoms: fatigue, muscle loss despite exercising, difficulty maintaining focus, sleep disruption. We ran a red blood cell magnesium test, not a serum magnesium, which is largely meaningless, but an intracellular red blood cell magnesium, which actually measures what is inside your cells. His result was 4.1 milligrams per deciliter. Normal is above 5.2. He was significantly deficient despite having no dietary habits that would suggest this. The reason was his proton pump inhibitor. George had been on a PPI for acid reflux for 6 years. PPIs reduce stomach acid, and stomach acid is required to absorb magnesium from food. 6 years of PPI use had created a profound intracellular magnesium deficiency that had quietly been suppressing his testosterone the entire time. We supplemented with magnesium glycinate, the form with the highest bioavailability and the least digestive side effects, at 300 to 400 milligrams of elemental magnesium per day, taken at night. Within 6 weeks, his red blood cell magnesium was up to 5.4. His SHBG had dropped from 67 to 51 nanomoles per liter. His free testosterone had risen from 6.8 to 10.3 picograms per milliliter. That is a 51% increase in free testosterone from magnesium supplementation alone. Before I continue, many of you have been asking about where to find quality mineral supplements. I have personally shortlisted a few vitamin and supplement suppliers whose products I believe are genuinely worth your attention for men over 60. Please check the description below. Those links are there because you asked, and I want you to have options I have actually reviewed. Now let me give you the complete magnesium protocol because the form, timing, and combination matter enormously. The form. Magnesium glycinate is the preferred form for hormone support and sleep improvement. Magnesium citrate is acceptable, but has a stronger laxative effect. Magnesium oxide, the most common and cheapest form in many supplements, has less than 4% bioavailability and is essentially useless for these purposes. Do not use magnesium oxide. The timing. Take magnesium glycinate 30 to 60 minutes before bed. Magnesium activates the GABA receptor system, the same receptor system targeted by sleep medications, and at the doses we are discussing, it significantly improves sleep architecture, particularly the amount of time spent in slow-wave deep sleep. Men over 60 who supplement with magnesium glycinate before bed consistently report more vivid dreams, which is a clinical indicator of deeper REM sleep, and more refreshed mornings within 1 to 2 weeks. The test. Ask your doctor for a red blood cell magnesium test specifically, not serum magnesium. The serum test reflects what is in your blood, which the body keeps stable even when cells are severely depleted. The intracellular red blood cell test is the gold standard, and the only one that accurately reflects your true magnesium status. The dose. For most men over 60, 300 to 400 milligrams of elemental magnesium as glycinate per night is the appropriate starting dose. If you are on a PPI or a diuretic, your needs may be higher, and you should work with your physician to determine the appropriate amount. I want to close with something I say to every patient who comes to me with low free testosterone and has never had their magnesium properly tested. I tell them, before we talk about any other intervention, before we talk about testosterone replacement, before we talk about any prescription, we test your magnesium. Because in my experience, a significant proportion of men with low free testosterone are magnesium deficient, and fixing the deficiency is the most important first step. It is the foundation without which everything else is less effective. If this video gave you a new direction to investigate, leave a comment below telling me whether you have ever had your magnesium tested. I am genuinely curious. Like this video, subscribe for weekly science-backed content specifically for men over 60, and share this with someone who needs it. I will see you in the next video.